So, let's talk about a medical story of reinvention. We're talking about antiretrovirals, or ARVs. You probably know them as the drugs that completely changed the game for HIV, turning what was once a death sentence into a manageable condition. But their story didn't end there. It got a second chapter, and honestly, it's just as revolutionary. Okay, let's just dive right in because this is exactly where the science has taken us. For decades, ARVs were all about fighting an infection that was already there. But now, these same incredible drugs have a second job: to stop HIV before it even gets a chance to start. And the way they do this is through a protocol called post-exposure prophylaxis. We just call it PEP. The easiest way to think about it is like an emergency brake for the virus. It's not a cure, and it's definitely not a vaccine. But what it is a critical, time-sensitive window to prevent a lifelong infection. So here's how we're going to break this down. First, we'll look at how ARVs took on this brand new role. Then we'll see it in action in three really critical situations: protecting newborns, keeping our frontline workers safe, and providing a lifeline after a sexual assault. And finally, we'll get into the universal rules, the race against the clock that makes it all work. To really get this, you gotta go back to 1995. The arrival of triple drug therapy it was a miracle. It changed everything for people living with HIV. But even back then, scientists were already asking the next big question. If these drugs are so good at suppressing the virus, could they maybe stop it from ever getting a foothold in the first place? And this is the fundamental shift in thinking you have to grasp. On one hand, you have ARVs as a lifelong therapy for people who are HIV positive, keeping the virus under control. And on the other hand, you have them as a short-term emergency tool for people who are HIV negative to block the virus from ever setting up shop. Two totally different missions, all from one powerful class of drugs. All right, let's jump into our first scenario, and it's one that really shows the power of this idea. We're talking about protecting the most vulnerable among us, newborn babies. So here's the problem. An HIV-positive mother can pass the virus to her child. It's called mother-to-child transmission, or MTCT, and it can happen during pregnancy, birth, or even through breastfeeding. For a long time, this was just a tragic reality of the epidemic, but it was also a clear challenge that really demanded a preventative solution. And the solution they came up with is just brilliant. It's a two-part strategy. First, the mother starts lifelong ART. This hammers her viral load way, way down, making transmission so much less likely. Then, and this is the genius part, the baby gets a daily dose of an ARV for their first 6 weeks of life. It's a double layer of protection, a safety net for the baby, and it has saved countless lives. Okay, so now let's switch gears and look at a totally different situation: occupational exposure. This is all about our healthcare workers, lab techs, first responders, basically anyone whose job puts them on the front lines where they might come into contact with the virus. So a big question here is, when do you actually need PEP? Well, it's not for every little thing. Medical teams have really clear guidelines. A deep needle stick from a contaminated needle, yeah, that's a significant risk. A splash of certain body fluids into your eyes or mouth, also a risk. But, getting tears or sweat on your skin, that doesn't carry a significant risk, so PEP isn't needed. It's all about a very careful evidence-based assessment. Our next scenario is an incredibly sensitive one, and I want to be really clear here. Understanding that this medical protocol exists is absolutely vital. It can be a literal lifesaver for survivors of sexual assault. In the traumatic moments and hours after an assault, there is a clear, calm, and completely non-judgmental medical protocol available. It's focused entirely on care and prevention. It uses the same ARV drugs we've been talking about, but obviously the context and the urgency are on a whole other level. And this is what's so critical to understand here. The urgency is dialed way, way up. Now, we're going to talk about the 72-hour absolute cutoff in a minute, but for survivors of assault, the goal is to start PEP within just 1 to 2 hours. Why? Because the physical trauma of an assault can unfortunately create more ways for the virus to get in, making every single moment count. So we've looked at 3 very different situations where ARVs are used as a preventative shield. Now, let's pull all the threads together and look at the universal, non-negotiable rules that apply to PEP, no matter what the circumstances are. Okay, if you remember one number from all of this, let it be this one: 72 hours, 3 days. PEP must be started within this window. It doesn't matter if it was a needle stick in a hospital or an assault. The second a potential exposure happens, that clock starts ticking. So why 72 hours? What's the magic in that number? Well, it's all about hitting the virus while it's still vulnerable. We're trying to stop it before it can fully integrate into your cells and start making copies of itself. Once it's established itself, it's there for good, and that window of opportunity for PEP has closed. And it's not just about starting on time, the commitment is just as crucial. PEP isn't just one pill and you're done. It is a full 28-day course of medication, and sticking with it, taking every single dose on time, is absolutely key for giving it the best possible chance to work.
So let's just walk through the whole process, step by step. First, an exposure happens. Step 2, you seek medical help immediately. Critically, the first thing they'll do is a rapid HIV test. If you're negative and you're inside that 72-hour window, you start the 28-day course. And then, of course, there's follow-up testing later on to confirm the final result.
And that brings us back to why that first HIV test is so important. This quote really nails it. See, giving a short 28-day course of PEP to someone who is already living with HIV, it just doesn't work as a treatment. Worse, it could actually help the virus learn how to fight off those drugs, creating resistance and making future treatment a lot harder for that person. So when you boil it all down, the takeaway is pretty simple. These powerful drugs, ARVs, have a second life as a preventative tool. From protecting newborn babies to offering an emergency option after an accident or an assault, these protocols are out there, they work, and they are incredibly time-sensitive. Just knowing they exist is the first and most important step. And that really leaves us with one final big question to think about. We've got these amazing scientific tools at our disposal. So the challenge now becomes awareness and access. How do we make sure that in a moment of panic or crisis, people know that this clock is ticking and that there is a powerful, life-changing opportunity to act? Thanks for diving into this with us.